On Thursday, the Charlotte Maxeke Hospital unveiled a new multi-million-rand medical storage facility. The modifications were made possible through a partnership with Gift of the Givers. Director Imtiaz Suleiman says the fire in the stores department, which took place in April of 2021, was a severe setback for one of the most important health facilities in the country. Dr. Joe Phatla, Minister of Health, and Nomantunko Morale Hoko, the MEC of Health and Wellness, both attended the unveiling ceremony. To tell us more about the collaboration, we're joined by Badr Kazi, who is the Director of Strategic Partnership and Corporate Governance. Thank you very much for your time, Mr. Kazi, this morning. Perhaps let's just go back a little bit and you can tell us how you collaborated with the Charlotte Maxeke Hospital.
Hi, good morning. Thanks for having us on. Yeah, collaboration started, I think, in COVID. And Dr. Suleiman got a call from the CEO on the day of the fire, asking for help to sort of move patients to other facilities. And Gift provided the ambulances, and it was an excellent effort by the CEO's team and Gift of the Givers to evacuate patients to 17 other facilities in the province. That's how the relationship started. Mm-hmm. And subsequently, everybody was under the impression that the fire would be, or the damage was fairly contained, and then the disaster would be over within a few weeks. That was sort of the thinking at the time, and we obviously know what's happened since.
Sure. This project did not go off without any challenges. Just outline some of them for us.
Yeah, Dr. Suleiman's a bit of a visionary, so, I'm sometimes the last to know about these things. He phones me up late at night, I think about 2 weeks after the fire, and tells me, look, get the infrastructure team, the architects and everybody ready. I want you guys to, go to the hospital and assess, do a professional assessment, because at that time it was clear that, we're in for the long game. And because of funding constrictions and all of that by national and local government, it was clear that a hospital of this importance, could not be neglected. And that's how we got involved. We put together our infrastructure people put together a brilliant team. And it took us about 2 months to do the planning and the necessary drawings and get to a sort of first-class facility, which is what Dr. Suleiman's brief was. And it took us 8 months. We actually came in under budget and we came in within time. So, our team did very, very well. The facility lacks nothing. So we got chuffed. I'm sorry to be modest, but we got chuffed at the outcome.
As you should be, especially because you also came under budget while meeting deadlines. So you pumped in some 60 million rand into the project in the absence of actually showing our viewers what is inside the hospital for now, at least. Can you perhaps just describe it, especially in terms of the major changes that were made?
Yeah, look, it was an old nursing facility which was abandoned for the last 2 decades. And it had good bones, so it was a good sort of facility to work on. And a hospital of Charlotte's size needs a sizable storage facility, because remembering that the genesis of the fire was in the storage facility. And our architect then came up with the idea that what we should do is have the new facility designed in several compartments, whereby it's sort of isolated in terms, if there's a fire or any disaster in the future, it's sort of isolated in a block system. So the hospital or the facility will not be in danger of the type of devastating damage that we've seen. Obviously, 50 or 60 years ago when this was designed, this was, with the patient levels and all of that, at no way could anybody have foreseen what was, what was going to happen into the future. So she's designed it with the view of, I think, 30 years, for a capacity of 30 years. So it's been sort of a visionary plan and state-of-the-art equipment. I mean, when you walk in, the lights go on. When you walk out, the lights go off. There are fire hydrants, new world-class fire sort of facilities. I think the technical guy should have been on with this, really. And so the facility lacks nothing in terms of meeting international standards. And it's 3,500 square meters. So it's a facility that other hospitals in the province can share too. So it's got, the best security. It's got cameras in each room. It's got orthopedic stacking. So in other words, whoever stacks the medicines and so on and so forth, it's sort of orthopedically designed. So all these sort of nuanced things were taken care of. So it's quite an advanced facility.
It sounds like it. And so moving forward, will you be working closely with the hospital? Because you can have this beautiful facility and now it will be left up to whomever is going to be taking care of it to manage it properly.
Superb question. On the day we had that sort of discussion with the CEO, who I might say is an exceptionally humble and brilliant individual. Her leadership, and together with her colleagues, was sort of really, exceptional in this regard. The Gauteng Health Department spoke to us about continuous maintenance. We have our infrastructure team will be maintaining the facility regularly. Look, for the first 2 or 3 years, it's sort of essentially self-maintenance. All the equipment that have sort of been put into the facility are guaranteed for, I think, 20 years. So, and we're handing all those documents over to the department. But there will be, there is recourse. So in other words, our teams will be looking after the facility for the next 3 years. And that's already costed into our initial budgets. I'm sorry about that.
No worries, Badr Kazi. Thank you very much for the work that you guys do. He is the Director of Strategic Partnerships and Corporate Governance at Gift of the Givers.